privilege to introduce the chairperson for today's review. He is a distinguished academic, accomplished public health expert, and dedicated leader in medical education and health systems development. Our chair today is the Dean of the School of Medical Sciences at Ghana's premier institution for medical training and research, the University of Cape Coast. He is a professor in population. Our chairperson has held roles in family planning, reproductive health, of building the capacities of the next generation of scholars, and health professionals through strategic partnerships and collaborative research. He continues to drive forward innovation and solutions to address Ghana and Africa's pressing public health challenges. Our chairman is a devoted husband and father of three, and is widely regarded as a mentor and father figure to many young professionals and students, including myself. Ladies and gentlemen, please join me in welcoming the chairman for today's review, Professor Sebastian Ellis.
I believe we can do better for Prof. No wonder you are his brothers. So I believe that was even an abridged version of Prof's profile.
Thank you very much, and good morning. I don't think I'm the one. So please look for that person that she gets introduced. And sometimes when you sit and you listen to these things, you wonder whether you have been able to do all these things. And that makes me, it looks like I'm getting to retirement now. I remember a few years ago when we were running around as students. We graduated as house officers, running around. We entered the world of work. We thought they'll never get close. We're just 2 years away from retirement. So it's just nice that we are able to do some of these things to support the Mother Africa. So thank you very much, Reggie, as I call it, my sweetheart. Okay, so Director, Regional Health Directorate of the Ghana Health Service, representatives of the Minister, if they are here, Minister of Health, if they are here, representative of the Central Regional Minister, reps of the Ghana Health Service Directorate, if they are here, representatives of development partners, if they are here, distinguished ladies and gentlemen, good morning once again. I'm very pleased and honored to be invited as the chairperson for this morning's review program. And this, I believe, is the media review of the Central Regional Directorate of the Ghana Health Service, which is themed Improving Access to and Quality of Primary Health Care, Everybody's Business. This year's theme is very important, and I believe that it is also very timely. At the heart of every resilient health system lies a strong primary health care foundation. One that brings care
people and addresses not only disease, but the broader determinants of health and well-being. According to the World Health Organization, or for the World Health, when you are doing these things and you don't mention them, it means that you are out of order. According to the World Health Organization, primary health care is a whole of society approach to health and well-being, centered on the needs and preferences of individuals, families, and communities. The World Health Organization outlines 3 core components of primary health care. 1, meeting people's health needs throughout their lives through promotive, preventive, curative, rehabilitative, and palliative care. 2, systematically addressing broader social, economic, and environmental determinants of health. 3, empowering individuals, families, and communities to take charge of their health. The hallmark of primary health care includes equity in access, not equality. Equity in access to health care. Community participation, intersectoral collaboration, that's what means everybody's business, use of appropriate technology, focus on disease prevention and health promotion. That is what happens. Now this one I have to read because it is important. And we need to set the basis for our discussion. A robust primary health care system relies on the effective functioning of the 6 building blocks of the health system: leadership and governance. 2, health care financing. 3, health workforce. 4, medical products, vaccines, and technologies. 5, health information systems. 6, service delivery. Please take note of these things because I'm going to use them as a checklist. So when you come and you are doing your presentations, I will check, check, and check. So if there are gaps, it means there are a lot of gaps in these 6 areas. It means that we are heading towards a weak primary health care system, and we need to fix them. It is easy to fix them. I believe that these are, what we do is like a jigsaw puzzle. You look for the gap, you fix. You look for the gap, you fix. And that is why we need to be guided by some things. Our national and global ambition to achieve universal health coverage is deeply rooted in primary health care. Universal health coverage is about ensuring all people have access to quality health services without financial hardship. Primary health care is therefore the most cost-effective and inclusive pathway to achieving this vision, especially for underserved and rural populations. Ladies and gentlemen, improving access and quality of primary health care cannot be the sole responsibility of the Ghana Health Service. It demands strong stakeholder engagement, including local government, authorities, traditional leaders, civil society organizations, private sector actors, development partners, academia, community members, also inclusive. Together, we must mobilize financial and human resources, share data, and strengthen health information systems. Innovate in service delivery and advocate for policies that uphold equity and access. So I'm ending. I wish to commend the Regional Health Directorate, the District Health Directors, facility managers, and our hard-working frontline health workers for your unwavering commitment and resilience despite the numerous challenges. Your efforts are saving lives every day. Nonetheless, we must boldly confront persistent challenges that include staff shortages, inadequate infrastructure, inequitable resource distribution, and emerging health threats. As we engage in this mid-year review, let us be critical yet constructive, honest yet hopeful, and above all, driven by a shared commitment to health equity. Let us commit to strengthening primary health care as the bedrock of a healthier central regime and a healthier Ghana. Thank you for your attention, and I wish us all a successful and impactful review session. Thank you very much. And on this note, I want to accept to be the chairperson for this review process. Thank you.
Thank you, Prof, for accepting to chair this session for us. Ladies and gentlemen, we shall proceed and acknowledge some dignitaries in our midst. On the high table, to my extreme left, we have our Deputy Director, Public Health, Dr. Jojo Governor. Can you give us a wave? Then our own mom, the mother, the leader of the Regional Health Service, Dr. Mrs. Alberta Ejabe Richu Nyako. We are also blessed to have in our midst the rep of our Honorable Regional Minister in the person of Mr. Asuma Brahma. He is our Metropolitan Coordinating Director. Next to him is our own father and brother, Deputy Director, Human Resource of the Service in Central Region, Mr. Kojo Fesi. And we have our own father again, Mr. Sirin Akwanya, our Deputy Director, Administration. We also have Mr. Simon Echampon. He's the Operation Manager for Operation Smart Ghana, the Project Manager for Operation Smart Ghana. Dr. Agana Isiri, focal person for an advert, also in our midst. Ms. Linda Ya Kwabia, She is the health desk at the Regional Coordinating Council. Mr. Sebrak Ejei Bekon, Territory Manager, DKT International, also in our midst. The head of the Quality Assurance Department of National Insurance Authority, Dr. Mrs. Becky Boachi Yado, also in our midst. The head of St. John's Ambulance Ghana, Miss Ekia Frema Osompe, also in our midst. Dr. Alfred Champon, Acting Chief Pharmacist at the Regional Health Directorate. Our Deputy Director Finance, Mr. Michael J. Benson, also in our midst. Ms. Abigail Diaba, also with Operation Smart Ghana. All medical directors and superintendents here, please can you give us a wave? Medical directors, superintendents. All our district directors of health service, please can you give us a wave? Our district directors, you are here in your numbers. All principals of health training colleges, please give us a wave. Our RAD managers here, please give us a wave. Departmental heads invited. Can we see you, our departmental heads who are here? And our Alminaqua, the teacher one. So we'll continue with the acknowledgement as and when they arrive. So ladies and gentlemen, we'll now proceed and invite the personality who has been mandated to welcome us officially to this program. We'll humbly invite our Regional Director of Health Service, Dr. Mrs. Alberta Ejabi Kuchumyako, to give us the welcome.
Thank you, PRO. Good morning. Good morning.
Good morning.
Thank you very much. Our distinguished chairperson, Professor Sebastian Eliasson, the Dean of School of Medical Sciences, University of Cape Coast. The representative of the Honorable Regional Minister of the Central Region, Mr. Asuma Adam Braima, Coordinating Director for Cape Coast Metropolitan Area. Our regional parent, the representative of the DG, Mr. Peter Opriekwa Esquire, who is listening online. Our expected Honorable Municipal, Metropolitan and DCEs, special invited guests, respected colleagues from the Regional Health Management Team, our District Health Directorates, health facilities, both public and private, our cherished development partners, both here in person and online, any traditional or community leaders who have joined us, members of the media, our cherished staff, ladies and gentlemen. It is a great pleasure and an honor to welcome you all to the Central Region, especially Cape Coast, for this important two-day semi-annual performance review meeting with the theme, Improving Access to and Quality of Primary Health Care, Everybody's Business. On behalf of the Ghana Health Service and the entire regional health leadership, I bring you warm greetings and express our deep appreciation to each of you for making time to participate in this critical dialogue. Primary health care remains the bedrock of our health system, the first and most direct level of care where prevention, treatment, and health promotion happen. It is here in our CHIPS compounds, health centers, maternity homes, clinics, polyclinics, hospitals and district hospitals that the majority of Ghanaians receive care. And it is here that we must focus our strongest efforts if we are to achieve universal health coverage and meet the health-related sustainable development goals. Prof. Chair, ladies and gentlemen, this year's theme, Improving Access to and Quality of Primary Health Care, Everybody's Business, could not be more timely, just as the chairperson said, and even more urgent. We are reminded that primary health care is not just the responsibility of health workers. It is not confined to hospital walls or policy boardrooms. It involves every one of us, health professionals, policy makers, community leaders, traditional authorities, civil society actors, and indeed, communities themselves, as our chairperson has already said. As a region, the Central Region has made significant strides in expanding access to primary health care. Yet, we also continue to face challenges, limited resources, staff shortages, geographic and social barriers to care, and persistent quality gaps. We cannot tackle these issues in silence. We must build stronger collaborations across sectors, empower our frontline workers, and engage communities meaningfully in the design and delivery of health services. This summit presents an excellent platform to reflect on our progress, share practical experiences, discuss innovative strategies, and most importantly, strengthen our collective commitment to primary health care. I encourage all participants to actively contribute, ask questions, and share insights as we learn from one another. Prof. Chair, permit me in this address to throw more light on the agenda for the meeting, and I'm sure everybody has got a copy of the agenda, so you may refer to it. Everything we have planned for this two-day meeting is about access and or quality of care of primary health care. We shall look at some key performance indicators through the lens of the holistic assessment tool and see where we are headed as a region. We shall honor our members of staff who have retired from active service within the year, as well as outdoor the vibrant Central Regional Health Management Team, which consists of the leads of the health service organizations and agencies in the Central Region, showing how strategic partnerships, networking, and mutual commitment to a common goal is epitomized in the Central Region. We shall also be served two panel discussions with real voices from all around us, talking to the theme, primary health care being everybody's business. And if we want to improve access and quality, and how we could improve 24-hour service delivery in the sub-districts, that's our health centers and CHIPS especially. We shall be blessed to hear discussions on whether CHIPS is still relevant in this day if we want to improve geographic access, as well as how networks of practice or primary care networks shall help us build sustainable local partnerships for better quality and access in primary health care wherever we are at. To improve quality, Prof. Chair, ladies and gentlemen, we need to ensure our staff are well trained, and the University of Cape Coast School of Medical Sciences has just a program we can all benefit from right down our alley. We shall hear more about their simulation center soon, and oh, it is loaded with CPD credits, so you would not want to miss that. Then we shall go on tomorrow to tell you more about how National Health Insurance and the National Ambulance Service are supporting to bridge the access gap financially and through emergency dispatch services, and how together we can improve in these areas, especially as we shall soon start the free primary health care program and other new initiatives to improve the health system. We shall know how our districts are faring and the help they may need from us, as well as take a deeper dive into how the region is performing in the areas of public health, clinical care, finance, health administration and support services, and human resource, for example. Last but not least, we shall have a presentation on how we could improve on the quality of primary health care if we did it right. That is through improved communication, collaboration, and coordination at the district level. Prof. Chair, distinguished ladies and gentlemen, I am confident that over the next 2 days, we will not leave here with only fresh ideas, but also with a renewed sense of purpose to make primary health care more accessible equitable, and people-centered for everyone, everywhere in the Central Region and beyond. Let me end by thanking our organizing team, our partners here and online, our special invited guests, Honorable MMDCEs, Mananum, the Regional Health Management Team members, Medical Director Superintendents, Metropolitan Municipal District Health Directorates and their teams, and every participant for your continued dedication to health service delivery in Ghana. Together, we can and we must ensure that quality health care is not a privilege, but a reality for every Ghanaian in every corner of our country. Thank you, and once again, welcome.
I believe we can do it better for our mother. Thank you, our Regional Director of Health Service. Indeed, improving access to and quality of primary health care is everybody's business. Ladies and gentlemen, we invite our choir from the Almina Polyclinic to give us a musical program. While this organizes itself, we also have in our midst our Chief Nursing and Midwifery Officer, Mrs. Margaret Nyaku Sampson. Can you give us a wave? I believe we can do it better for our winner for the closing choir. Indeed, the uplifting performance reminds us that healthcare is not just about medicine, it's also about the human spirit, which is a vital role in the healing process. Ladies and gentlemen, we have some acknowledgements. Mr. Kafui Agbedonu, Deputy Director, Policy Planning, Monitoring and Evaluation at the Cape Coast City Hospital in our midst. Mr. Abduka, of the head of the Environmental Health Service, Kari Seyu, who is also a member of the Regional Health Management Team. Ladies and gentlemen, as a service, we are not working in isolation, so we humbly invite some stakeholders to give us solidarity message, which I invite the rep from Cape Coast City Hospital, Mr. Kafui Agbedonu, to do us that honor. So shall we welcome him with a round of applause. He will be followed by Catholic Health Trust, and that message will be delivered by the Medical Director for Our Lady of Grace Hospital, Dr. Francis Denzel. Thank you.
Hello everyone, good morning. As you have already heard, my name is Kafui Agbedonu, Deputy Director of Policy Planning and Budget at the Cape Coast Teaching Hospital, and also the Acting Director of Administration, as my boss is on leave. I read this message on behalf of the CEO, Dr. Eric Ofinjedu, who had to be in Accra since yesterday, and the rains and other issues have not permitted him to be with us this morning, but he's on his way, so he said anytime he gets to Cape Coast, he'll join us. So on behalf of Dr. Njedu, I read, Regional Director of Health Services, the chairman of this occasion, permits me to stand on all already existing protocols. I am honored to participate in this half-year performance review held under the theme Improving Access to Quality of Primary Healthcare, Everybody's Business. This invitation is a testament to our shared commitments to advancing healthcare excellence within the Central Region and beyond. It underscores our collective resolve to position the region as a benchmark for health delivery in Ghana. On behalf of the management and staff of the Cape Coast Teaching Hospital, we wish to reaffirm our continuous support and dedication to the implementation of the government's free primary health care policy, which the Central Regional Health Directorate is preparing to roll out. We fully align ourselves with the objective of this policy, which seeks to improve access to quality of primary health care to all individuals in the region. The free primary health care policy represents a significant milestone in our journey towards the attainment of universal health coverage. It is a strategic intervention aimed at increasing healthcare accessibility, reducing health inequalities, and directly contributing to the realization with the sustainability goal 3, ensuring healthy lives and promoting well-being for all ages. The CCTH Polyclinic was established to help expand access to primary health care services and to complement services provided at the primary health level within the region. Hence, we assure you of our preparatory steps towards the rollout of this policy. As part of our institutional strategies, we will continue to offer capacity building programs, including availing our specialists for training, mentorship, and supervisory support to all DHS facilities to build a robust, responsive healthcare system that would promote innovation, research, and foster a culture of continuous improvement and excellent performance. This performance review meeting presents a critical platform for evaluating the performance and achievements. I therefore encourage all stakeholders and partners to actively contribute to the progress of the meeting as we undertake retrospective assessments and best practices to build strong structure to support the health service delivery throughout the region. On behalf of all members and staff of the Cape Coast Teaching Hospital, we extend our sincere gratitude to the Regional Director for the opportunity to engage. We look forward for deepening our relationship in building a resilient and inclusive healthcare system that prioritizes equality and expansion in health service. Thank you very much.
Professor Chair, permit me to stand on the already laid down protocol and procedures. I stand in the big shoes of our Director of the Catholic Health Service Press, who is presently not in the country. He's asking me to assure our new Regional Director that we are already with you all the way through. The Regional Health Director knows what the Catholic Health Service can do, and we promise to do and even do more. As you have come with a new energy, you can confidently and peacefully rely on us. What we can do, we'll do to help you to succeed and even raise the enviable data or the level of the Central Regional Hospital to higher heights. So on that note, we welcome you and assure you that we are with you all the way through. Thank you.
Thank you, Catholic Health Trust. We invite the rep from National Health Insurance Authority, Dr. Yadom, to deliver a solidarity message on behalf of the authority. Shall we welcome everyone?
Good morning, ladies Process, please. Let me stand on the existing On behalf of National Health Insurance, we extend our healthfelt solidarity and appreciation to the Regional Health Service. Madam, your unwavering commitment, professionalism, and resilience to delivering essential primary health care services, often under challenging conditions, serve as the backbone of our national health system. At a time when public health needs continue to grow, your tireless efforts in serving communities, promoting wellness, and upholding the highest standard of care are deeply commendable. The National Health Insurance Authority remains committed to supporting your work through collaborative efforts, timely reimbursement, and sustained partnership that advance our shared mission of achieving universal primary health coverage for all. Together, we will continue to strengthen our health system, improve access to quality care, and build a healthier future for every citizen. Thank you for your continued dedication, and we wish you well. Thank you.
Thank you, NHIA. We invite Mr. Simon Echampong, he is the project manager of Operation Smart Ghana, to also deliver a solidarity message. Shall we invite him?
Good morning, ladies and gentlemen.
Good morning.
People have been standing on the existing protocols. I guess I will lie on it. So, Mr. Chair, good morning. I bring you warm greetings from the country manager of Operation Smart Ghana. Operation Smart Ghana, we are glad that we're invited to partake in this important meeting. In the first half of this year, we collaborated with the Cape Coast Teaching Hospital to provide 71 free cleft surgeries. And we received massive support from the Cape Coast Teaching Hospital and also from the Ghana Health Service. Apart from the surgeries, we are also building capacity in the Cape Coast Teaching Hospital and helping them put together a cleft team so that clients who come to the facility looking for cleft care will not have to be referred to Kolebu or Konfanoche, but then will have cleft either leg or palate repairs done here at the Cape Coast Teaching Hospital. The capacity building is not just one day, it's a process. And so all the trainees from the hospital, we are constantly in touch with them, and we hope that we'll have a very strong team here. The primary health care is all of us, our business is indeed true. But in Operation Smile, it's not just about the surgery, because we realized in the past, some babies register with us at the time we want to do the surgery, we call them and they have expired. And because of that, basic nutrition has become a very important part of our work. And so basic care such as nutrition can save lives. And so I believe that with all the deliberations we'll have here, we'll all see how we can contribute to having primary health care accessible to everyone in our communities and making sure that we have a healthy country. I want to thank all of you for this great opportunity, and I wish all of us very fruitful deliberations. Thank you, and may God bless us all.
Thank you, Operation Smart Ghana, and may God bless you as well. For St. John's Ambulance Ghana, we have the regional head, Ms. Ekia Frema Bosompem, to deliver the solidarity message. Shall we please welcome her with a round of applause?
Good morning. Good morning, ladies and gentlemen. Honorable Chairman, please, good morning. And Madam, good morning. Well, we welcome you all, and we bring you greetings from the entire family of St. John Ambulance Ghana, which is across the entire region of Ghana. with our CEO, Dr. Akpezi Esquire, we bring greetings and we say that we at St. John is a part of an international charitable organization which was established by the British police in 1937. And it has its governing council, which is established by the Act of Parliament in 1959. And the Act 57 of 1959 to support St. John Ambulance in Ghana. It is actually a subvented organization, if many people do not know. It is under the Ministry of Health and it operates as a first aid training and service delivery organization. And with the inception of the Ministry of Health reform in 1996, Act 525, it became an agency under the Ministry of Health. So we actually collaborate with the ministry, and we are happy that we are giving our unwavering commitment and support to public health, disease prevention and emergency response. It continues to be a profound impact across the region. And we salute you, Madam, your leadership, resilience, and tireless efforts of promoting healthcare professionals who work day and night to support this primary healthcare. As our fellow advocates for health and humanity service, St. John Ambulance really supports Central Region. This year, we gave 28 volunteers to support the oral cholera vaccination, and we trained 80 personnel in first aid. We gave free certificates to all the 80 personnel, and included people from police service, the National Ambulance Service, and so many collaborators and our stakeholders. And we were happy that they came and they received this training. And we know that the support that we are going to give to them is going to stand, they are going to stand firm. And when there are accidents, they will be more bold to give health first aid to such casualties when it is needed. Together, we can build a healthier Central Region, one rooted in compassion, preparedness, and unity. We support this region, and our greetings and solidarity goes to you all. Thank you.
Thank you, St. John's Ambulance Ghana, for your solidarity message. Ladies and gentlemen, we invite Mr. Richard Awude, if he's here. He's the regional chair of Private Health Facilities Association of Ghana. Is he here? If not, we'll proceed and invite the head of the Regional Health Information Unit to take us through the performance, the holistic performance for the half year. Mr. Silani and his team, please, shall we welcome them with a round of applause? It's going to be a short presentation, 15 minutes.
Good morning. Good morning. Thank you very much for the opportunity. Standing on the listening protocol, I have the privilege to walk us through some of the holistic indicators. The holistic indicators in general, there are 94 indicators. But this presentation is mainly based on the ones that we can find in the Directorate. The others are indicators we assess outside it. But for them, it's available for all of us to see what is happening as of now. So basically, those are the ones I'm going to talk about. This presentation actually is not in the strict sense of holistic assessment, where we do the mathematics of plus, minus, before we arrive at scores. We just adopted. If there is a progress over the same period last year, it's green. If you are at the same level, yellow. If you have progressed with reference to last year, you get red. And we have some blue where we do the comparison between the previous year and previous year, half year, and this year. So generally in this, we have 71 reporting forms to complete. But as at half year, we should all be doing 50% of those indicators. But apart from 6 reporting forms, all the others are below 50. And the list is quarterly mass grant administration report during 12.1 for the period. Financial report completeness in games. Regionally, we are doing 46.8. The highest being Upper Delta West doing 90. Doing 50.6. Whilst Chifohima Lower Delta is doing 26.5. If you are doing 26.5 as a half year, I hope where you will be by the close of the year. You can do the mathematics. Family planning acceptance rate coverage. This is the target is the annual target we are aiming at. But as at half year, regionally we are doing 18.5. With the highest from Upper Delta East doing 26.5. And the least Agona is 12.2. If the pace continues and nothing changes, Agona East guidance will be 24% at annual. Well, preparing this, we understand that there were commodity shortages during the first half of the year. We are hoping that commodities will be available and this picture will change by the close of the year. Skill delivery across the region. Generally, as a region, we have been seeing a gradual decline in our skill delivery across the years. However, the future is doing 58% as at half year against the annual target of 65. Whilst Asin South is doing 10.8. With reference to their own performance for the same period, they have stagnated anyway. So when you see yellow, that means your performance same period last year is the same. When you see the red, that means despite your performance now, you have progressed. And the green says that you have improved over your same period with reference to this year. Postnatal coverage for new babies within 48 hours. This indicator actually, every district for that matter, every facility should be doing 100%. Because you deliver the baby within 48 hours before the resident leaves the facility, or even within 24 hours, conduct postnatal care activities and document and report. However, we are not seeing as we ought to see. Those in red, with their own performance the previous year, they have progressed. And you can see the reds and the yellows dominate, which means there's something happening with this indicator, and we need to back up to improve on this before the year ends. ANC registrants making 4th ANC visits within the period. Target is 85%. Regionally, KEA is doing over 100%. And sincerely, the challenge with this over 100%, when we met at the validation before this meeting, it came out strongly. People were coming out with all sorts of ideas, but anyway, that is the data we have as of now. We should critically interrogate this over 100% coverages and ensure that going forward, if we have to come up with data change request form to correct some of the things, we do so. Percentage of children due for business 2 receiving LLIN. Target is 90%, and regionally we are doing 94%. And Abura Civil Supermarket is doing 100% as the best, with Asin South doing 88%. This is supposed to help us prevent transmission of malaria. So if we are not distributing the nets as we ought to, we are creating gap for increase of malaria among our population. Babies breastfeeding within 1 hour, or babies put to breast after delivery within 1 hour. Regionally, we are doing 97.52. House for human rights, the best is 100, and Upper Densha West is doing 96 as the lowest. Skill Delivery Geographic Equity Index. This measures the distribution of midwives across our districts. Regionally, from 2023, Efutu always comes as the best. Files as in South always comes as the West. So this can also inform HR when they are doing their postings for midwives, because consistently, I think South cannot be always West, because that is the underlying calculation. So we have to look at it. Proportion of functional chips. Our register is our chips database that is supposed to feed DIMS. That is supposed to feed DIMS. But interestingly, DIMS have high and some outrageous figures. When you visit the chips database, apart from Gomwa East, Trifohima Lower Densha, Upper Densha East, and Upper Densha West, what the register is saying is what you see in DIMS, while the others is not the same. There's always back and forth. Correct, return, correct, return. But I don't know the challenge. Whether managers also appraise this database before final submission. Sub-districts implementing community scorecard. This is the only indicator that gives the power to the community to assess the service we are providing. Every CHMC is supposed to assess our health facility on quarterly basis and give us a score. And that information is entered into this. But districts like AOB, Toma West, KE, and some Upper Densra East have not reported anything for the first half, which means this data simply means that they don't have CHMCs in their districts. If they have, they are not doing any assessment. But how can you be providing services and you don't have the opportunity to be assessed by the community? So we need to take this indicator seriously. If they are doing the services or they are doing the assessment and they are not entering, that one, regionally, this is what we are seeing. So we need to look at it closely. Cost of their certification. Regionally, as of now here, we are doing 50.1%. Apart from those in green and probably in yellow, all those in red, certification, they are not doing it as they ought to do. And this is purely a hospital-based indicator. So the hospitals who are not doing the certification and the data being entered appropriately, maybe as part of the discussion, we will find out the challenges why the certification is not happening and the data is not being entered. Based on this data, without a complete course of death certification, we cannot have top 10 cause of death or any number of range we want to give. So if we have 50% of the data, and this is our cause of death outlook, what if we have 100% certification? I believe this outlook will be different. And this will also inform the kind of interventions or trainings we have to conduct, depending on what is killing the population we have in the region. Incidence rate of diabetes. This is supposed to help us measure how our NCD program is running in the region. A range of lower range of 1 and a higher quartile of 5 is given to us. Apart from Cape Coast, all the other districts have not reached even the lower limit, which means screening for diabetes is not happening. That is what the data is saying. If it's happening, but the data is saying it's not happening as it's supposed to. Which means we must look at awareness clinics and the documentation as well as the reporting. Same as hypertension. As for hypertension, we do not even meet the lower quarter before we'll be able to go for the upper quarter. Originally, we are doing 1.02. So our awareness clinics on the ground appears not to be functioning as it ought to because the data is saying so. I'm not the one saying so. Proportion of children who were measured for stunting. This is not to say the children are stunted. When they come for CWC, do we measure them? That is what this data is saying. F2 is doing 66.2. And Upper Densra West is doing 32.1. Do we have the infantometers for the measurement? Or do we have the graduated scales on the walls for the measurement? It is out of that we can get this data properly captured and reported. Regionally, we are doing 43.6. But the target is 10%, which means we are doing very well. I hope this target will change with time when we review this holistic indicator scores. Prevalence of anemia in pregnant women at 36 weeks of gestation. I think this is one of the indicators that our team talks to directly, because it's not health officers who should raise technically the HB of pregnant mothers before they deliver. The food, the community the opinion leaders have an influence on this. So the list is coming from, I think, Fosu, which is good, and the West is coming from Goma Central, 54.6, which means all mothers who delivered or who reached 36 weeks visited our facilities. Goma Central has seen 54.6% of those mothers having their HB lower. Routine vitamin A. During our CWCs, babies are supposed to be given vitamin A. And the target is 80%. The question is, do we have the vitamin A? Yes. If we have, why are we not giving it and documenting at the same time reporting? Apart from Upper Denshire West, it is doing about 92%. Goma East is doing 31%. So we ought to find out why we are not giving out the vitamin A's. Maybe if I have, I'm not wearing my glasses. So let's help the children not to get glasses as early as I have. Percentage ANC registrants registered within the first trimester. You know, traditionally people get pregnant, they want to wait for some time before they report to the facility. This indicator can improve if we improve on our communication. The health promotion unit, the public health unit, and every other medium encourage mothers to seek for early registration when they are pregnant. The list is coming from Ewuti Senior 41, and the best is a Jumako Enyam Museum. And regionally, we are doing 56.3, and the target is 55. Regionally, we have up a little bit. And you can see the Greens also dominate over the rest, which means same period last year, we have improved over our own performance. Penta 3 coverage. Yearly target is 97%. Regionally, we are doing 47% times 2. All things being equal. Regionally, we will not meet our target. Goma Central is doing 35% as at half year. And this is a measure of the quality of our immunization. And you can see the reds dominate over the greens, which means with reference to our own performance for the same period last year, most districts have progressed. Did we have shortage of the vaccines? If the answer is no, then we need to look at how our outreaches are running for the second quarter of the year. If not, our immunization will be challenged. Children under 5 years who are underweight, we should be doing 3.8 or less. Regionally, we are good. But as in South, 2.7, Upper East, Upper Denshire East, Goma East, Ewuti Senior. Are actually the children, are they actually underweight? Or is our skills? We need to look at it and see what is giving us this high numbers. Institutional all-cause mortality. This is measuring all the deaths for the first half within our facilities, irrespective of content. We should be doing 18% or lower. That is the national target. But KEPCOs are seen North, AAK are seen South. We are doing above the 18. This simply means the hospitals within these districts are the ones contributing to this. Are we actually analyzing why the people are dying? Do we have something to do to prevent these deaths? Those are questions we need to answer passed with aim at reducing this. Maternal mortality ratio, regionally, we have dropped compared to same period last year. But the interesting thing is that more facilities have reported more maternal deaths than same period last year. Though the figures have come down, but now more facilities have reported. Previously, we had 13 facilities reporting, but now we have 16 facilities reporting same maternal deaths, though the numbers are lower. So, we need to look at it critically. That is what this chart is saying. The maternal deaths must be audited and entered. Couples is the only district that have not audited all their maternal deaths. And we would like to know why. And I know our friend teaching hospital will be the helping boy in this one. Returns on delivery. This data is a transactional information on all mothers who have come to deliver. And you can see that the rest are many, which means the data is not being captured by the hospital. Regionally, we are doing 33.6%. But that data is rich or is supposed to help us understand the types of deliveries that are happening in our facilities. And if we need to what? Intervene or train within the obstetric care space, we can rely on this data. However, based on the little data we have, these are the complications based on the data captured for deliveries, complications. Institutional neonatal mortality rate per 1,000. Regionally, with reference to our own performance, we are worsening off. And all those in red also means with their own performance same period last year, they are worsening off. But we are below the target for the nation. Stillbirth rate, same. Target is 11.5. Regionally, we are doing 8.12. And we have improved regionally, but some districts have worsened up with reference to their own performance. And we need to understand what is pushing up these numbers. This is a breakdown of the stillbirths. The fresh, macerated, and the deliveries. The deliveries were added for a specific purpose. Florence Maternity Home have done just 15 deliveries. One stillbirth. If they should increase their delivery, that is the message I want to communicate with this data. Sun City, 16-1. Asia, 44-2. A place like Cape Coast Teaching Hospital has done 1,253 deliveries with a stillbirth of rate of 20.42. That means the skills and the capacity is there. So, if we want to do our subsequent trainings on life-saving skills, we need to also now start targeting where we go. If we go back to the big places again, we may not be able to help ourselves well. Measles rubella. This is the second year of life antigen. Target is 90%, Regionally, we are doing 45%. Times 2, we will hit our 90%. But a district like Gomwa Central, 28.7, will never get close to the 90 if nothing is done differently. The best is Ewutu Senya with 55. But with their own performance, they have also regressed. So I think these are all discussion points we need to look at. Average length of stay at an emergency ward or accident and emergency center. 2, we are doing 1.5, which is quite good, which means we stabilize and we quickly bring the person to where the appropriate unit the person should go. Bed occupancy also, regionally we are doing 68%, which is okay, but the national target is 70. We are close. Inpatient mobility and mortality. This is another data set that takes transactional information on all admissions. And this data will inform us to know the causes of admission. And if only 25.6% of the data is captured, cause of admission, this is the picture. If we want to intervene using this data, we may be addressing the wrong information or the wrong area because you don't have enough data. Percentage of medicines prescribed by generic name by district. Triple active mokwa. I don't understand, but I can hazard the guess. The officers there appears to be absent. So anything is just being entered. I just got to do this privacy. Because these percentages, I don't believe they are right. Say, injection, press, encounter with an injection. Say, so I think my hazard or my guess is good for them. We have to look at this and work at it. Antibiotics, we should be doing 20% or less when we come to the facilities. We are doing regionally 39% and 57% at, I'm not mentioning town because it's the same thing running through for the data issue from their end. So we ought to look at how antibiotics are prescribed to avoid antibiotic resistance as literature or studies are showing us that we are heading there. ART coverage, regionally, we are doing 40% as at half year. The best is Asinfosu doing 92%. And Asin South is doing 0.5. HIV, as the services sees in that district, is it reporting? Don't they have medicine? I think this is a nice discussion point. Viral load testing coverage. Target is 50%. Regionally, we are doing 21.5. Best, KE is doing 52. And 1, 2, 3, 4, 5, 6, 7, 8 districts have not reported anything for the half year. We would like to understand. However, the midwives are doing their bit at the PMCTC. So, if this is happening at the ANCs, why is this issue? TB case fatality. Regionally, we are supposed to do 5% or less. Regionally, we are doing 4%. But districts like a Tutu, a Jumako, a Kumfi, up to THLD, your fatality rates go too high. We try to address this. TB notification, regional, we are doing 22%, target is 50%. The list is Goma East 9.1, whilst Upper Densra East is doing 40.5, very close to the target. So, if Upper Densra East is doing 40, while Goma East is doing 9.1. TB treatment success rate, target is 90%, regionally we are doing 88. With this indicator, I would say most districts are doing quite well, except the Jumako and malaria testing before treatment. Quite good. We should be doing 100%, and regionally we are doing 98%. And most districts are close to the 100%, which means the 3 T's are working very well during 7 days. Surgical site infection rate. This slide is a demonstration to the fact that we are not looking out, or we are not picking this indicator and reporting it aside, because it cannot be zero throughout. This indicator simply is asking, within 48 hours after surgery, did a client return with a site infection? If yes, document and report. So are we saying all our surgeries, there was no return? Praise the Lord. People living with HIV enroll on TB preventive therapy. TB and HIV, we know they are friends. But unfortunately, I see now a Kumfi, people human lower than track. All people with HIV have not been enrolled to any TB activity. I would like to understand why. Pregnant women tested for syphilis. This is one of my good indicators, irrespective of what is happening. Is always good. Pregnant women taking IPT-3. This is supposed to be given to pregnant women to help them give birth to babies with good weight, and also to help them not to be attacked with malaria. But Upper Densra West, they are doing 8%. Why? Don't we have the medicines? The answer is yes, fast. Non-polio AFP rate. This is surveillance on polio. We are not saying the person is having polio. Do you suspect? Suspect and report. If surveillance is working very well, all these people should know how to help. And you can see the reds. That means surveillance on this, with reference to last year, has worsened off. Despite people have moved up their own performance against themselves, they are worsened off. Everything appears to be red, which means surveillance in that area is not good for this year. And if it continues for the rest of the year, we are likely to run difficulties. Case fatality for cholera, meningitis, and yellow fever. 2025, because our friend cholera visited us, we have some deaths. So you can see the map. These are all cholera deaths, except plus over here, one meningitis death. With reference to same period last year, you can see the map is more white than 2025. Regionally, we are doing 4.5. And we should be doing less than 5%, which is good for us. This is not a typical holistic indicator, but this is just to tease our mind. ANC agenda, this is for secretary. Maybe during the year I'll do for clinical. On the average, each day, 180 days, mother and child have seen 66 people on each day for ANC. Each day. Whilst they have deleted 16 mothers each day. This has nothing to do with the staff on a day. While some people are doing 2, some are even doing 0. So when it comes crying, I need more staff, for midwives. If I sit at the table, I will still give more to mother and child of the Kashmiri and because this data is telling me that some days you go and sick, nothing happens. That's why I say it's just it's not a holistic indicator. It's just to tease our mind, to start asking more questions than the normal ones we ask. So you can see all these facilities here. On a day, they've not done anything. And look at the average age. Hello? So, regionally, 43% of our indicators have improved. 6.8% has stagnated. And 50% has progressed. So this is our scorecard for the half year. If we don't change things, this scorecard will be worse when we hit the panel. And I think this calls for the beginning of the discussion. Thank you very much.
Thank you very much, Mrs. Lancy. Please, let's do it better for him. Right. This presentation is an eye-opener for the 2025 holistic assessment, and all districts lacking behind, please, we encourage you that from here, we put in the necessary work and be able to close the gap ahead of the annual review. Thank you. So please, we proceed to the next item on the bill, and before I do that, I have the singular honor to introduce the presence of the Deputy Administrator of National Ambulance Service in the person of Miss Alice A. Please, if you are here, give a wave. Thank you very much. Whilst we take the podium, please, we continue with the keynote address. And that will be done by the environment Asuma. Please, let's put it up.
Good morning. Prof, Chairman, you can see my dressing may not be appropriate for this day. I had a different task this morning. I was in the field when I had a call from the Regional Coordinating Council to be here to represent the regional minister. So I will try and fit in his big shoes. For that, I have a few things to say. Health. good health for that is the singular most important commodity that we continue to chase throughout our lives. You don't regularly take good care of your health. The condition may force you to do that. You will report to the hospital and you will be reminded to take good care of yourself in terms of that. The most important aspect of our lives. I see health as an asset that may require some amount of money to purchase. We have heard and we have seen people sell their assets to seek for health. That's why I see health as an asset. We must keep it well. We must take good care of our health. Reviewing our programs and activities is the right thing to do. But Regional Director, you are welcome. Well, from the indicators that have been presented, you have a long way to do. You have a lot to do. I don't know where the challenge is. You are doubting your own data by the presentation we listen to. It looks like people are just entering things, or they don't understand what is required. Don't we have IT officers? If we have, let's train them. And let's keep our eyes on what they do. And let's also keep a close watch on our. One of the biggest issues we have as a country is the issue of data, inadequate data. It is when you have reliable data that you can take better decisions to be able to improve the lives of people who come to your facilities to seek for help. So if your data is wrong, you'll get everything wrong. Prof. Chairman, I want to re-establish the protocols, and I will not allow anybody to break them. Prof. Chairman, representatives of the Director General, the Regional Director of Ghana Health Service, District Directors and Medical Superintendents of the Ghana Health Service, heads of departments here present, development partners here present, representatives from the academia, distinguished invited guests, the media, ladies and gentlemen. Like I said in the beginning, I'm reading this address on behalf of the Honorable Regional Minister for Central Region, Eduamoa Ekokeni Oche, who has been called on an emergency to Gomwa East. That is why it's not here. He would have loved to be there. So I'm presenting this address on his behalf. It is with a deep sense of commitment to our collective health agenda I join you this morning at this important 20 half-year performance review meeting at the Central Regional Health Directorate. Let me identify with the Regional Director of the Ghana Health Services to welcome you all to this event and to use this opportunity to commend the Regional Director, management and entire staff of the Central Regional Health Directorate and all health personnel across the region for your tireless efforts, sacrifices, and resilience in delivering essential health services to the people of the Central region and beyond. Your dedication and hard work remain the backbone of our progress in public health. Distinguished ladies and gentlemen, as we all know, primary health care is indeed essential for building strong, equitable, and sustainable health systems. And for that matter, achieving universal health coverage. It remains the foundation of any functional health system because it is at the community level where the first contact occurs. Health is preserved, diseases are prevented, and equity is either realized or denied. The first contact of almost all of us is at the community level, where we have clinics, gym compounds, and others. So to be able to preserve health and to give people the services they need, we must strengthen our performance at that level. It is against this background that I find the theme for this half year's improving access to and quality of primary health care, everybody's business, timely and appropriate. Of course, health is everybody's business, starting from your homes before you get to the health facilities. I'm reliably informed that the team reflects the Ghana Health Services renewed focus on strengthening the foundations of the health system through equitable, accessible, and high-quality primary health care services. It is a known fact that primary health care remains the first point of contact for most Ghanaians and services as the serves as the backdrop for achieving universal health coverage. However, persistent challenges such as geographic and financial barriers, limited infrastructure, workforce gaps, and inadequate community engagement continues to affect access and the quality of care delivered at that level. Professor Chairman, distinguished ladies and gentlemen, I wish to state emphatically that improving public health service is indeed everybody's business, as health is not just a sectoral issue, but a societal one. The government, private sector, development partners, traditional authorities, community leaders, civil society, and every individual must play a role. The government of Ghana has reaffirmed to building a resilient, equitable, and high-performing primary healthcare system, anchored on the goal of achieving universal health coverage and the Sustainable Development Goals 3, among which the accelerated chiefs revitalization. Under this policy, the government has prioritized the revamping of chiefs compounds across the country, functional, well-equipped, and adequately staffed. In this year, additional funding has been allocated to refurbish dilapidated chief compounds, chief zones, and to ensure essential drug supply, maternity services, and basic diagnostic and available and ensure that basic diagnostic and let me take it. In this year, additional funding has been allocated to refurbish dilapidated chief zones, and to ensure essential drug supply, maternity services, and basic diagnosis are available, for which our region has its own fair share. There is the network of practice model, which was piloted in various years and to be scaled nationally this year. This approach seeks to enable better coordination, referrals among chief zones, health centers, district hospitals, thereby reducing fragmentation and improving efficiency. 2025 health center budget allocation saw a notable increase in public primary health care, especially for basic health structure, supply chain logistics, and community health outreach. The Metropolitan Ministerial and District Assemblies, MMDAs, have also been directed to allocate portions to local health initiatives. I'm happy several agenda 11 hospitals, including those in underserved district in the central region, are expected to be operational in 2025. These facilities will indeed reduce access barriers and support public health care through emergency services, maternal care, and diagnostic to improve health service delivery and ease the burden of referral centers. There is an urgent need for all stakeholders, including our development partners and NGOs, to continue to complement government efforts through technical assistance, innovations, and resource mobilizations. Our traditional leaders and community members have a role to play by supporting health initiatives in your various communities. You must encourage your members to use health services, especially antenatal care, immunizations, and preventive health services.
Thank you, Jennifer.
I would like to urge our media to use platforms to educate, inform, and promote healthy behaviors. Professor Chairman, Nananum, distinguished ladies and gentlemen, it is my hope that this half-year performance review will provide an excellent platform to assess how we have come and what more must be done. Engage in honest dialogue, celebrate your successes, and critically examine areas where performance has fallen. Where performance has fallen short, and come out with smart solutions that will enable you to achieve your goals to ensure every Ghanaian, regardless of location or status, has timely access to quality primary health care. Indeed, health care is the business of everybody. Thank you, and God bless us.
Thank you very much. Right, that was a powerful message. We thank you very much, Mr. Asuma. So we continue to the next item. And before we do that, please, I want to introduce to you the Tufuhene of Ogwa Traditional Council, Nana Kwame Medu Ese. All right, thank you very much. Indeed, health is wealth, and today, with whatever that we are doing here, and I must, we are going to put in the necessary efforts. We can't mind our business alone. Health is important, and we all have to come together and work things out. So it's everyone's business. Right. Abraham Lincoln once said, A nation that does not honor its heroes is not worth dying for. And at this moment, RHD has also initiated certain directives and approaches on how we can honor some of our workers and our staff. And to do this, the Regional Director of Health Service, Dr. Mrs. Albert Rachel Nyahu, to lead us on this session. Please, a round of applause.
Thank you very much, Mr. MC. As has just been said, we shall be honoring those of our staff who have retired honorably from active service, and also one of our senior members who has been transferred to the Bono East region, that is our Deputy Director for Finance. But before we do those awards, Central Region has established a different kind of regional health management team. Normally, what we call regional health management is actually a central Ghana Health Service management team. But in the light of how we want to strengthen our primary health care towards achieving universal health coverage, and knowing that health is not just the but all other stakeholders and working in private, in academia, all have a role to play in health. We have expanded our regional health management team in the real sense of the word. And our regional health management team is a group of professionals who plan, direct, and coordinate healthcare services within our organization area in this particular instance. The key responsibility of the management team is planning and strategy, resource management, quality assurance, coordination, policy and compliance, and performance management, amongst others. Remembering that our core mandate still remains primary health care. This wider and comprehensive approach brings together all players, organizations in the health sector under a common vision of accelerating the delivery of universal health coverage through stronger and better primary health care service. Healthcare and other sectors need to work together to ensure all decisions affecting health are addressed in an integrated way. That is health in all policies approach. But those of us in the health service delivery space must work together first and foremost. This working together includes promoting policies to protect and improve people's health and well-being, providing information, services, preparing for and responding to health emergencies together to ensure the highest possible level of health and well-being and their equitable distribution. It is also key to strengthening the resilience of health systems to prepare and recover from shocks and crises. The Central Regional Health Management Team concept is a collaborative care that brings together professionals or organizations to work in partnership with people to achieve a common purpose. We engage in dialogue with policymakers and leaders to foster the creation of environments and cultures that support collaborative action and facilitate interprofessional ways of working. We have been working, focusing on several critical topics. We are reviewing our current program, strategic planning, putting things on the front burner as supposed to. We are forwarding key issues to the regional, honorable regional minister's office as well as the DG's office, and also to other offices like the regional police command and so on for redress. Through open discussion and collaboration, we aim to strengthen our team's effectiveness and enhance our ability to serve the people living in the central region. So I shall go through the membership. Some of them, the people are here, others will be represented, and most of the time it is the institution we are referring to. The most preferred person to be on the team is the team lead, but some people also designate some of their deputy directors to stand in for them, and we do not lose any good thing. So in no particular order, I shall start with the Senior Management Committee of the Regional Health Directorate. Deputy Director Finance, please, can you stand at the far end? Deputy Director HR. Deputy Director Administration. Acting Regional Chief Pharmacist. Regional Internal Auditor. Chief Nurse Officer. Deputy Director Clinical Care is not here. She's on official assignment outside the region. I hope I've exhausted essence. Regional Internal Auditor is not here. The representative of the Regional Director of National Health Insurance, Dr. Wachia, yes, please join. We also have the Zonal Deputy Director for CPC. I don't know if she has a representative here, or Deputy Director Quality Assurance, Dr. Wachia, will stand in also for the CPC. Thank you, Doc. Representative of the CEO of Cape Coast Teaching Hospital. He was here, but he has a health emergency, so he has just gone back to the hospital. Child representative, that is the Catholic Health Service Trust. And Father Nyenyo is not here, but he has asked Dr. Benzel to stand in for him. Thank you, Dr. Benzel. Regional manager or representative of the National Ambulance Service. Yes, Officer Alice, she's been with us from the beginning. Regional Director for Environmental Health, our dear Tobe. Head of Ankafo Psychiatric Hospital, or his rep. The medical directors of the 3 public university hospitals. So we have medical director of UCC Medical Center, medical director of University of Education Winneba, the hospital, and medical director or rep of Cape Coast Technical University Hospital. We have our own chairperson, the Dean, School of Medical Sciences, UCC. We have the representative of the health training colleges, Koheti. They are not here. We also have the representative of the Private Health Facilities Association. So we are still expecting Mr. Ude. He's been with us in all our meetings. Representative of the Society of Private Medical and Dental Practitioners. I think they're also having their AGM this week, starting today, so it's not surprising they are not here. Representative of St. John's Ambulance, the regional head. President of the Medical Superintendents Group. Medical Director of our regional hospital, Trauma and Specialist Hospital, Dr. Kwame Gwedu, and President of the District Directors Group. Yeah, have I left anyone out? Okay. So, at this point, invite the representative of the National Minister, who is the Metropolitan Coordinating Director for Cape Coast, to do us the honors of recognizing the invaluable service that the leaders of these agencies and institutions are doing for the service. And he shall do this by putting around their necks one of these, I don't know, to honor them and to show them that we recognize their contribution towards improving the health system in the central region, and that we are in this together. Thank you. Boom, 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 boom. As part of their busy schedule and the various things that they do, they never miss a meeting. And when they come for the meeting, all of them contribute. Nobody is a spectator. Do you give us some small music in the background? Okay.
For this initiative. Indeed, legacy building is a collective responsibility. We are famous. Thank you so much, Director, and we are so proud of you. Indeed, improving access and quality of primary health care is everybody's business. So, ladies and gentlemen,
course, just to set the environment for us, and just as we've seen today, and it's open door but we're still within the threshold. Right. So we move on to the awards ceremony, and this is what I was talking about. An initiative set up by, RH, just to honor its staff, and we have a couple of them here, and we'll. And at this moment, please, I'll call on the president of the VDHS group to do an honors by presenting one of our citations to our staff. Please, if you are here, let's see you. And before then, the citation will be read by Dr. Pallet Brown. Please, let's give it up for her as she walks here. Right. Right. So the first presentation, that is for Mr. John Aqua. Please, if you are here, let's see you. Mr. John Aqua. Or if the transport manager is here, please. All right, then. Please, let's put it up for him. The transport manager is here. Right, so the citation will be read by Dr. Collins.
Central Regional Health Directorate, Cape Coast. Citation in honor of Mr. John K. Akpa. February 20, 2002 to December 2024. With deep respect and profound appreciation, the Central Regional Health Directorate proudly presents this citation to Mr. John K. Akpa in recognition of the exemplary service to Mother Ghana. Was appointed into the Ghana Health Service on 1st February 2002 as a driver, grade 2. Over the years, he distinguished himself through hard work, dedication, and a strong sense of responsibility. Through determination and excellent service delivery, Mr. Akpa rose through the ranks to become the yard foreman. Duty and dependable service have contributed to the smooth running of the Directorate and the overall success of its activities. We celebrate your outstanding contribution and wish you continued blessing and fulfillment in all your future endeavors. May God richly bless you. Signed, Dr. Mrs. Alberta Ejaben Richum-Nyaku, Regional Director of Health Service, Central Region, on the 6th August 2025.
All right. Please, let's put it up there. All right, so that's for Mr. Akpa. Thank you, TM. Thank you, Mr. Samuel. Thank you. Right, we'll move on to the next, and this award will be presented by Dr. Kwame Boedu, Medical Director of Trauma. Please, if you are here, let's see you. Please come. Right, and this will be presented to Mr. Stephen Kojo Korte. Please, are you here? Mr. Korte. Mr. Okay. So, right. So, DDF accounts, please. Mr. Michael, can you do that? On behalf of Mr. Korte, please.
Central Regional Health Directorate, Cape Coast, citation in honor of Mr. Stephen Kojo Korte, July 1995 to July 2025. With sincere appreciation and heartfelt gratitude, the Central Regional Health Directorate is pleased to present this citation in honor of Mr. Stephen Kojo Korte. Of its steadfast commitment and exceptional service. Mr. Korte appointed into the Ghana Health Service on the 4th of July 1995 as a junior accounts officer and has served as the Regional Health Directorate (RHD) for an exemplary period of 30 years. Through hard work, professionalism, and commitment to excellence, he rose
rose steadily through the ranks to become a principal account officer. In recognition of his diligence, integrity, and exceptional contribution to the financial management of the Directorate, Mr. Korte was honored by the RHD as the overall best staff for the 2024. A statement to his enduring impact and exemplary service. As we celebrate this milestone, we express our heartfelt appreciation for your invaluable contribution to the Ghana Health Service. Signed, Dr. Mrs. Alberta Ejabin Richum Nyaku, Regional Director of Health Service, Central Region, on the 6th of August, 2025.
All right, please, let's put it up. Name 95. You know what? Please, we'll bring more men. Right. Thank you very much, Dr. Boyko as well. Please, let's give it up for them. Right. So we continue with the next, and this will be done by the medical superintendent group, the president of the medical superintendent group, that is Dr. Michael Danso. Please, if you are here, the rep, or okay, he's here. Will be given to Mr. Charles Kofi Ishen. Mr. Ishen. Mr. Charles, please, let's give it up for him.
Central Regional Health Directorate, HEPCO's citation in honor of Mr. Charles Kofi Ishan, October 1991 to May 2025. In recognition of his dedication and outstanding service to Mother Ghana, Mr. Charles Kofi Ishan began his distinguished public health career as the District Disease Control Officer in the then Abuna District, where he served diligently from October 1991 to June 2003. In July 2003, he was transferred to the Central Regional Health Directorate, where he joined the Disease Control Unit as a Regional Surveillance Officer. His commitment, technical expertise, and exemplary leadership soon earned him additional responsibility. In 2004, he was appointed as TB coordinator, a role in which he worked tirelessly to strengthen TB control efforts across the region. Following the retirement of the then Regional Disease Control Manager in March 2016, Mr. Ishan was entrusted with the dual responsibilities of Regional Disease Control Manager and Regional TB Coordinator. He served in this capacity with distinction retirement in 14th May 2025. Over the more than 3 decades of dedicated service, Mr. Ishan made significant contributions to the surveillance, prevention, and control of communicable disease in the Central Region. As you retire after a remarkable career, we salute you for your immeasurable contribution to public health. Signed, Dr. Mrs. Alberta Ejabin Richum Nyaku, Regional Director of the Health Service.
Please, let's put it up for
Surgical maintenance.
Right. Thank you very much. Just when I thought 95 was a long service, we have 91. Indeed. Maybe we shall. Alright, so we're doing the final presentation, and this goes to our BDF, Mr. Ernest Bediaku. But unfortunately, we are having the same program as his new region, so Mr. Michael will step in for him. Yes, and that will be done by our affable mom, that's the Regional Director of Health Service. Right.
Central Regional Health Directorate, Cape Coast, citation in honor of Mr. N.S.C. Albediaku, Deputy Director of Finance, October 2018 to June 2025. With profound gratitude and deep appreciation, the Central Regional Health Directorate proudly presents this citation in honor of Mr. N.S.C. Albediaku in recognition of his exemplary service, professionalism, and invaluable contribution to the Ghana Health Service during his tenure in the Central Region. Mr. Albediaku served as the Deputy Director of Finance at the Central Regional Health Directorate from October 2018 to June 2025. Throughout this period, he consistently demonstrated exceptional professionalism, sound financial stewardship, and efficiency in management of public health resources. His insightful leadership, technical expertise, and collaborative spirit significantly enhanced the planning, budgeting, and implementation of financial policies that supported the deliveries of quality health services across the region. As he takes up a new assignment in the Bonny East region, the Central Regional Health Directorate extends its heartfelt appreciation for his outstanding contribution. His legacy as excellence, dedication, and integrity will continue to inspire those who he leaves behind. We wish Mr. N.S.C. Albediaku continued success and fulfillment in his new role. May God richly bless and guide you in all your future endeavors. Signed, Dr. Mrs. Naku, Regional Director of Health Service, Central Region, August 2025.
All right, then. So that's for Mr. Albediaku. Thank you very much. Thank you very much, Dr. Brown. So, because of time, we're going to our chairman's remarks. Because of time. So, please, welcome our chairman here, Prof. Please, let's put it out for him once again.
So thank you very much. And so let's all give ourselves a big round of applause. This meeting has been very engaging, and I am excited that I came. And I guess this meeting started a bit late, and I can't help but comment on it. And I'm hoping that Ghanaians will do better. I went to Rwanda just 2 months ago for a conference, and if they say it is 8 a.m., it is 8 a.m. They will start whether there are two people seated or not. And it was done throughout the meeting, 1 week. So you will be forced to sit down, especially if you are playing a major role in that meeting. So let's all try to sit up when it comes to time. Well, so we started with the did that so well. I know that the future ahead is bright. You're already the regional director of health services. In how many years? 10 years. Right, so we were welcomed by the Regional Director of Health Services and to build strong collaborations across all sectors. And I think that, let's applaud her, she has exhibited that already by widening the regional health management team. You know, this is the first time I've been in this region for over 50 years. And this is the first time this management team has been that inclusive. And I know with this team, the region will go places. So let's clap again for that. He also urged us to ensure efficient community engagement. Sometimes we think the health sector can do it all, but we can't. And so community engagement is key. Leadership in the community starts from the regional regional House of Chiefs. And that is where the engagement should start from. And then we sit down to the local communities where our chiefs reside with all their elders and even the community members. We don't have to take that for granted. And then as we learn bottom-up approach on sustainability of our intervention, we shouldn't look at all with community engagement. And she also reminded us that commitment of service providers is also key. And sometimes you are assigned as a health service provider, you go to work and you think that you are doing somebody a favor. I don't think that is right, because you chose to. So if you chose or you were called to serve, what do we see nowadays? Money. Money. Everything is money. If you don't put cash down, forget it. But let me assure you that if you become selfless, the money comes indirectly. And that is what service should be. Service to God, service to man. And everything else shall follow. We have all experienced that. Don't let money be your key. I'm a dean of the school. Admission, come and see. Can get $1 million every year. But please, if you become selfless, you never want. So thank you, Director, for reminding us. The solidarity messages. Cape Coast Polyclinic, Cape Coast Teaching Hospital. I am happy that at long last the polyclinic has come, has been set up. The expansion has taken place to support primary health care. Because sometimes you go to the teaching hospital emergency, and it's chaos. So I guess the polyclinic coming on board on stream will help so much. We have experienced, and it is really supporting the teaching hospital to support the teaching hospital. We also promised to strengthen capacity, and we hope they will live up to that promise. The NHI, timely reinvestment, true or false? The last time we went to the regional health management, everything was NHI. And they had to defend themselves, defend. So I've been a private practitioner before, and at the time, reimbursements were not forthcoming, and so I had to collapse my clinic and go back to teach, and that's why I came to Cape Coast. They were not paying it, so my equipment, I've carried them to Directorate. So I'm here to distribute them free of charge. Everybody who wants them. Operation Smile. Thank you very much for setting up the cleft care team. I think this is so timely, and I guess that will go a long way to support the central region. It's just unfortunate some of the children passed on before they got help, but with the setup of this team, I guess that it will go a long way. St. John's Ambulance. I think I left Catholic Health Service Trust. They have promised strong support to the regional Director of Health Services. And we know the Catholic Church has done so well when it comes to education, when it comes to health We know even in some of the districts, it is the Catholic hospitals that serve as the district hospital, but government hasn't been able to cover it. So let's give them a very big round of applause. If we don't do that, the Pope will know about it, and then he shall close down all the hospitals. So St. John's Ambulance has also promised us a lot, and we hope that they will deliver on that. The holistic assessment. Where is the man who said us? He was so passionate about it, and as he delivered on it, I just watched him deliver. I was just waiting for the last blow, and indeed he did that very well. But as he did that, I also looked at, as I said, the 6 key areas proposed by the WHO that will support, proper health outcomes, successful health outcomes. And indeed, we failed on many. Worst of all, the data capture that the keynote address reminded us of. Because whatever you put in, if you put in chaff, you get chaff. Sometimes people are putting in data, they won't even look at what they are using. They are. What's the ancient computer do? Whatever comes out, whether it's 200%, and you cannot explain. But some way, somehow, people do that without cleaning the data before. Sometimes even the data that people capture, they go and sit under the coconut tree, or sometimes the beer bar when they are drunk, and they put in data. Because whatever it is, there is no penalty. Whatever wrong data they put in, salary will be paid at the end of the month. So that's whenever you see 100 and something percent, it doesn't make sense. They will sanction all of them. There will be no salary. So the proper thing is that people will just do things anyhow. We need to sit up. Ghana is old, and we need to set the pace and set it well, especially in this modern era. Data is key. Data is very key. And so we need to do very well about it, because that is what determines interventions, that is what determines government's allocation of resources to the health sector. So we need to do it very well. And of course, the Dow's blow was that 61 indicators have fallen short, 6 have stagnated. The improvement is suggested in 3 the indicators. So already we know that we are not doing very well with the holistic assessment reports. And then the keynote speaker, he reminded us. In fact, we want to thank you very much. Let's clap for it, because I remember before we came here, I said today I have not been assigned here. I was even going to come. So thank you so much for coming. And you delivered your keynote very well. And you also reminded us to take our health very seriously. You see, health is a state of what? Complete physical, mental, social, and spiritual well-being. Not merely the absence of disease and infirmity. Prior to World War II, they say health as what? Absence of what? Absence of disease. Okay, so disease was absent and you were healthy. That was prior to the World War. But on the WHO country, they redefined it. So if you don't get money, you are sick. And that is why I'm sure people want the money so much. But you don't want, But social doesn't mean money. Social doesn't mean money. So don't let that be an excuse. So thank you for reminding us to take our health seriously. And then you also reminded us about the data. You were also not excited about the data gaps. So we need to sit up with the data. And government has promised. Our government, they promise. They promise. How will is key to everything that we do. I remember when we were developing the Maputo Plan 2016 to 2030, issues of political will. They didn't want us to highlight strong. But I told them, no, this is key. Because if government, everything that we do will fail. I remember when we were working in UFP, sometimes we go to the table to discuss commodity security. You see, government will be perching at the corner, and then you will be watching partners. How much are you putting? How much? They ask, how much are you putting in government? No answers. So we are hoping that this promise will be delivered, so that we can offer what we are offering already. We will strengthen the base for our economy. So whatever. Because yesterday I was listening to a program on TV, GTV. They were having a discussion on financing the districts. And I know about 25 million cities or more have been, the first quarter have been given to the districts. So those of you at the district, please go to the districts. Health management, districts, health district assemblies. Please go there. I know what I heard it. Monies have been given through us. So please go to him Metropolitan. Go there. Take part of your money to deliver the health service that is required. And we are also excited that monies have been given to repair dilapidated ships and then to make them more functional and to improve diagnostic services. The awardees, it is nice to go on retirement. And I hope those of us who haven't gone should prepare for our retirement. I know some of us are like 10 years. It's true. Some of them 10 years. They thought that even that retirement will not come. It will eventually come. Okay, but let us all prepare for our retirement. Because as I sit here, I just wish that tomorrow I'm going home. I wish. Because I'm tired. I'm tired. So let's all prepare. Because if we don't, some go on retirement, really, I haven't been there, but I've left jobs 3 or 4 times. I've retired about 4 times. When I was leaving the UN, I told myself I'm retired. I'm only coming here to while I wait the time. So if you prepare well, you will enjoy your retirement. What is nicer? When you wake up in the morning and you are just there, not under pressure. You can pound food and eat. Yes. Go and buy graphic and read. If you play golf, 3 p.m. you go and play golf. In the evening, you network with your friends, talk about life. If you are lucky, get some consultants, you go and deliver. You can even deliver that from home. You know. So let's prepare for our retirement. A lot of us, when we are going on retirement, we are crying. Why? Because we haven't prepared. Please don't retire to your village where the small boys and girls are sleeping. You are likely to pass early because they will insult you. There was this old man coming to occupy this room. Okay, so please, we have seen it, that's why we are saying it. So let's all prepare for retirement. And congratulations, 30 years is not easy. Working, consistently for it's not simple. Some did not make it. traveling the road, assignments, control programs. It's not simple. But we thank God that He has put mercifully upon us. And you are still alive. So continue to do good. So, all too soon, it is over for the first session, and I want to thank you for having me as a chairperson. Thank you so much.
Please, let's give it up for him once again. Right. Someone has touched on all areas, and then, we'll be leaving here very soon. And at this moment, before we leave, there will be photo session down there, photograph, with a high table, then in order of merits, RHMT, District Director of Health Service, MedSuits and Directors, then reps of health training institutions, partners, and invited guests. So please, we're doing that right when we leave here. So before we move, we have thanks, and that will be done by Miss Enima. Please, let's give it up to her.
Thank you very much, MC. We always stand here and say to God, I'm hoping that greater things He will do. Amen. Prof. Chair, words cannot thank you enough for the precious time you have spent with us. We are so grateful for reminding us to plan for our retirement. Sitting back and listening to you, as young of Ikea, sit up and start preparing. So thank you for bringing that up for us to serve as a reminder to prepare for our retirement. Prof has been the chair for our program. Once again, we are so much grateful. He didn't come alone. The entire UCC team present here today, we are so grateful. Dr. James K. Prada, the Director, UCC Health Service, we are grateful for your presence. University of Education, Winnipeg, on behalf of the Regional Director, we want to express our sincere thanks for our invitation. To the rep of the Central Regional Minister, Mr. Brahma Asuma, the busy schedules we know, but you have made time and spent these precious moments with us. All we have to say as a region or as a service is thank you. The CEO, CCTH, Cape Coast Teaching Hospital, the rep who came on his behalf, we are grateful. The rep Catholic Health Service, we are also grateful for your presence. Anchor for Psychiatry, the director, we are grateful. For all our health partners here today, words cannot express our sincere thanks. Operation Smile, we are so grateful. As a region, we forever remain embedded onto you. And Nesbach, we are grateful for your presence. St. John Ambulance, for all the promises, for all the hard work. What we can say is thank you and God bless you. The National Health Insurance Authority, for the time you have been with us, we are also very grateful. And all other high health partners who are here with us today to celebrate or review our performance for the first half of 2025. We thank you for the time, for the year, for the promises, for everything you are doing for us. For all the promises we are listed down, and we are praying that as we meet here again to review the next half of the year, adding it to this half to make the full year, those promises will be dealt with. Thank you very much. Elmina Pa, year in, year out, you've been with us. You've shared some religious songs with us. We are grateful for your presence. The medical suit team, we are grateful. Nurse managers, thank you for spending this moment with us. The Metro Municipal Health Directors who are present here today, across all the 22 districts that we have in our region, we thank you so much for your time. The technical team behind this beautiful setup, we can't say thank you enough. We forever remain grateful. On behalf of the Regional Director and SMC, Prof. Chair, please allow me to thank one outstanding personality who year in, year out, exceptionally doing so well. The Regional PRO, we are so grateful for everything you do for the region. Thank you very much for your applause. Yaro, we want to say thank you and we recognize and acknowledge all the beautiful things that you are doing for the region. Our special appreciation to our regional director, Dr. Mrs. Alberta Ejabi Brichunyapo, under whose leadership we are seeing this. When I entered, I was looking at the environment, so calm, so serene, and he told me that yes, we are under a new leadership. We are so grateful. The environment, the room is so calm. It's beautiful. Thank you so much, Mami, for this outstanding leadership. We are praying that God will see us through the next half, and we will sit here and review one more time. SMC members, we thank you for your leadership. The RHD staff, we cannot say thank you and leave you out. We see all these things because you also helped through. Planning committee, Mr. MC, thank you. All present, we are so grateful. And I want us to remind ourselves about the theme for this year, the half year, improving access to and quality of primary health care, everybody's business. On behalf of all the health service workers, promise on our honor, be faithful and loyal to Ghana, our motherland. And we are praying that God will bless Central Region. Already be shrine fin mountain. Now we're shrine Nana no to Nana Abibia yet to answer for one hour. Or ye ferrodo. Also ye you are Name on sure we are praying that God will bless our homeland Ghana. God is definitely blessing in Fin mountain. And He's going to make us great and strong. Thank you very much.
Thank you very much. Right, all too soon, we are coming to the end of the first session. And we have two sessions. So from here, we're going to have our snacks. Put it down a little bit. We are going to have our snacks down there. So the invited guests will use the conference room while the rest of us will use the podium outside. So please, we'll be recessing soon and our high table will do that for us. So Elmina Park, please, kindly give us a seating music as our high table recesses.
Praise the Lord.
Let's welcome